Hello doctor, what does the report say?
Yeah, she's having varicose veins.
Oh, can you please explain about it to us?
Yes, sure. Varicose veins are twisted, enlarged veins. Any superficial vein may become varicosed, but the veins most commonly affected are those in your legs. That's because standing and walking upright increases the pressure in veins of your lower body. For many people, varicose veins and spider veins, a common mild variation of varicose veins, are simply a cosmetic concern. For other people, varicose veins can cause aching pain and discomfort. Sometimes varicose veins lead to more serious problems. Treatment may involve self-care measures or procedures to close or remove veins. Symptoms of varicose veins. Varicose veins may not cause any pain. Signs that you may have varicose veins may include veins that are dark purple or blue in color, veins that appear twisted and bulging. They are often like cords on your legs. When painful signs and symptoms occur, they may include an achy or heavy feeling in your legs, burning, throbbing, muscle cramping and swelling in your lower legs, worsened pain after sitting or standing for a long time, itching around one or more of your veins, skin discoloration around a varicose vein. Spider veins are similar to varicose veins, but they are smaller. Spider veins are found closer to the skin surface and are often red or blue. Spider veins occur on the legs but can also be found on the face. They vary in size and often look like a spider's web. Come, I'll show you some of the images like how actually the varicose veins looks like.
Yes doctor, sure, let's go.
Self-care such as exercise, elevating your legs or wearing compression stockings can help you ease the pain of varicose veins and may prevent them from getting worse. But if you are concerned about how your veins look and feel and self-care measures haven't stopped your condition from getting worse, then you're supposed to see your doctor. Could you have brought her here at the right time?
What causes varicose veins?
Weak or damaged walls can lead to varicose veins. Arteries carry blood from your heart to the rest of your tissues, and veins return blood from the rest of your body to your heart, so the blood can be recirculated. To return blood to your heart, the veins in your legs must work against gravity. Muscle contractions in your lower legs act as pumps, and elastic vein walls help blood return to your heart. Tiny valves in your veins open as blood flows towards your heart, then close to stop blood from flowing backward. If these valves are weak or damaged, blood can flow backward and pool in the vein, causing the veins to stretch or twist.
Can you explain us the risk factors?
Sure, let's move into the cabin since we are already done with all the tests. I'll explain you all there. These factors increase your risk of developing varicose veins. Age. The risk of varicose veins increases with age. Aging causes wear and tear on the walls in your veins that help to regulate the blood flow. Eventually, that wear causes the walls to allow some blood to flow back into your veins where it collects instead of flowing up to your heart. Sex. Women are more likely to develop the condition. Hormonal changes during pregnancy, premenstruation or menopause may be a factor because female hormones tend to relax vein walls. Hormone treatments such as birth control pills may increase your risk of varicose veins. Pregnancy. During pregnancy, the volume of blood in your body increases. This change supports the growing fetus but also can produce an unfortunate side effect: enlarged veins in your legs. Hormonal changes during pregnancy may also play a role. Family history. If other family members had varicose veins, there is a greater chance you will too have it. Obesity. Being overweight puts added pressure on your veins, so it may also be a reason. Standing or sitting for a long period of time, your blood does not flow as well if you are in the same position for a long period. Sometimes there can be complication of varicose veins. Although rare, it can include ulcers. Painful ulcers may form on the skin near varicose veins, particularly near the ankles. A discolored spot on the skin usually begins before an ulcer forms. In such case, you're supposed to see the doctor. Blood clots. Occasionally, veins deep within the legs become enlarged. In such cases, the affected leg may become painful and swell. Any persistent leg pain or swelling warrants medical attention because it may indicate a blood clot, a condition medically known as thrombophlebitis. Bleeding. Occasionally, veins very close to the skin may burst. This usually causes only minor bleeding, but if there is any bleeding, you're supposed to seek the medical help.
Is there any way to prevent these varicose veins?
There is no way to completely prevent varicose veins, but improving your circulation and muscle tone may reduce your risk of developing varicose veins or getting additional ones. The same measures you can take to treat the discomfort from varicose veins at home, which can help to prevent varicose veins, including exercising, watching your weight, eating a high fiber, low salt diet, avoiding high heels and tight hosiery, elevating your legs, changing your sitting or standing position regularly. Now, speaking of the treatment, self-care such as exercising, losing weight, not wearing tight clothes, elevating your legs and avoiding long periods of standing or sitting can ease pain and prevent varicose veins from getting worse. Compression stockings, like wearing compression stockings all day, is often the first approach to try before moving on to other treatments. They steadily squeeze your legs, helping veins and leg muscles move blood more efficiently. The amount of compression varies by type and brand. You can buy compression stockings at most pharmacies and medical supply stores. Prescription strength stockings also are available and are likely covered by insurance if your varicose veins are causing symptoms. If you don't respond to self-care or compression stockings, or if your condition is more severe, then you may have to undergo one of these varicose vein treatments. Sclerotherapy. In this procedure, your doctor injects small and medium-sized varicose veins with a solution or foam that scars and closes those veins. In a few weeks, treated varicose veins should fade. Although the same vein may need to be injected more than once, sclerotherapy is effective if done correctly. Sclerotherapy does not require anesthesia and can be done in your doctor's office. Foam sclerotherapy of large veins. Injection of a large vein with a foam solution is also a possible treatment to close a vein and seal it. A new technology like laser treatment can also be used to treat the varicose veins. This laser treatment helps to close off the smaller varicose veins and spider veins. Laser treatment works by sending strong bursts of light onto the vein, which makes the vein slowly fade and disappear. No incisions or needles are used. Catheter-assisted procedures using radio frequency or laser energy. In one of these treatments, your doctor inserts a thin tube, that is catheter, into an enlarged vein and heats the tip of catheter using either radio frequency or laser energy. As the catheter is pulled out, the heat destroys the vein by causing it to collapse and seal shut. This procedure is preferred treatment for larger varicose veins. High ligation and vein stripping. This procedure involves tying off a vein before it joins a deep vein and removing the vein through small incisions. This is an outpatient procedure for most people. Removing the vein won't adversely affect circulation in your leg because veins deeper in the leg take care of the larger volumes of blood. Ambulatory phlebectomy. Your doctor removes smaller varicose veins through a series of tiny punctures. Only the parts of your leg that are being pricked are numbed in this outpatient procedure. Scarring is generally minimal. Endoscopic vein surgery. You might need this operation only in an advanced case involving leg ulcers if other techniques failed. Your surgeon uses a thin video camera inserted in your leg to visualize and close varicose veins and then removes the veins through small incisions. This procedure is performed on an outpatient basis. Varicose veins that develop during pregnancy generally improve without medical treatment within 3 to 12 months after delivery.
Thank you so much, doctor, for explaining us in detail about the varicose vein. It really helped us a lot to gain the knowledge.
Yes, thank you so much for taking your time out of your busy schedule and explaining us.
Yeah, you're welcome. It's my duty to let my patients know about their problems in detail.